This video is intended only as an overview of the instructions and procedures required to operate the 3M Ranger Irrigation Fluid Warming System Model 247 with the 3M Ranger Irrigation Fluid Warming Set 24750. For detailed specifications, warranties, and additional information, please consult the operator's manual, instructions for use, or warranty supplied with the product. The 3M Ranger Irrigation Fluid Warming System is intended to warm irrigation fluids. The components of the 3M Ranger Irrigation Fluid Warming Set 24750 include spikes, white inlet pinch clamps, drip chamber, connectors, blue inlet pinch clamp, fluid warming cassette, white outlet pinch clamps, connector, patient line, roller clamp, and patient scope connector. After securely mounting the warming unit, plug the power cord into a grounded outlet. Open the warming set pouch. The fluid warming cassette will remain off the sterile field. The inner pouch, which contains the patient line and adapter, will need to be aseptically presented to the sterile field. Ensure the connectors are tight. To reduce the risk of leaking and loss of therapy, ensure that all connections are securely tightened prior to priming set. Present the inner pouch aseptically, which contains the patient line to the sterile field, taking note of the adapter piece in the pouch. Before priming, slide the fluid warming cassette into the slot in the warming unit. Close the white pinch clamps near the spikes. Obtain the distal end of the patient line from the sterile field and twist off end caps from the irrigation set and the patient line. Connect the patient line to the irrigation set. Insert the Ranger set spikes into the irrigation bag ports. To begin priming, open all clamps. Ensure the roller clamp is open. Invert the drip chamber until it fills at least 3/4 full, and then turn upright. Note: remove residual air bubbles by pinching the tubing. Close the white clamp on the patient line when the line is free of air. Turn the warming unit on. On startup, the unit reaches its normal operating set point of 41 degrees Celsius in less than 2 minutes. The LED display, located on the front of the unit, displays the warming unit temperature. The temperature of fluids is verified with sensors that check heating plates 4 times per second. Connect the patient line to the scope, Foley catheter, or similar device. The included adapter can also be used to connect the patient line to the scope, catheter, or similar device. Raise IV pole or pressurize fluid if indicated, and open clamps when ready for use. To reduce the risk of leaking and loss of therapy, do not exceed 245 millimeters of mercury. Ensure inline hand pressure pumps or other pumps do not exceed 245 millimeters of mercury. When you are ready to remove the disposable set from the irrigation fluid warming unit, close the blue inlet clamp proximal to the fluid warming cassette. Open all clamps distal to the cassette. Allow a small amount of fluid to drain from the end of the patient line to reduce pressure in the cassette. This may take about 2 or 3 seconds. Remove the fluid warming cassette from the warming unit and discard according to institutional protocol. As with any device, it is important to read and understand the detailed instructions for use and safety information. This device is restricted to sale by or on order of a licensed healthcare professional. If you have product questions, please contact your local 3M representative. Call the 3M Healthcare Customer Helpline at 800-228-3957 or visit our website. 3M offers device training upon request.